flat foot, uh, which is also known as pes planus. So what happens in the flat foot, we will see. So in this, it is a kind of a deformity, and there is loss of the medial longitudinal arch of the foot. So by medial means like the towards the your body. So it is, in lay terms we can say, it is the fallen arch of foot that cause the whole foot to make contact with the surface individually standing on. So that's what happens in the uh, flat foot. So you can see in the middle image that the medial arch has been uh, erased, or what are the causes, like let's see what the causes are. The valgus deformity at the subtalar joint, where calcaneus goes into valgus position, and at subtalar joint there is a pronation. See in the front image, there is a feet are pronated, calcaneus is in the valgus position. So this is a cause of the flat foot. So uh, and it is sometimes asymptomatic and relieves on its own. So basically it's of two types: flexible flat foot and rigid flat foot. So when the arch of the foot is intact on the heel elevation and non-bearing, but disappears on full standing on the foot. So when, as it is written here, so when arch of foot is intact on heel elevation, like when you elevate the heel, arch is intact, you don't see any of changes in your foot. But when you put weight bear on the foot, then the arch gets disappears. So it is termed as flexible flat foot. There is possibility of change in it. And when the rigid flat foot is when the arch is not present in both heel elevation and weight bearing. So when arch is not present, whether it is still standing or whether it is in the on the weight bearing or non weight bearing, arch is not present, so it is rigid. uh, what are the causes are mainly equinovarus deformity, ligaments laxity, ligaments are weak, uh, presence of accessory navicular bone, and uh, diabetes, obesity, foot and ankle injuries like trauma, you can say trauma, and eventually lead to flat foot. Genetic malformations like Down syndrome, Marfan syndrome, arch weakness due to overuse, certain form of foot conditions or injuries, some medical conditions, arthritis, spina bifida, cerebral palsy, etc. So all these are the causes. So yes, and what happens is like calcaneus, navicular, talus, first three cuneiform, first three metatarsals make up the medial longitudinal arch. So this arch is supported by the posterior tibial tendon and plantar calcaneal navicular ligament, deltoid ligament, plantar aponeurosis, flexor hallucis longus, and brevis muscles. So dysfunction or injury to any of these structures may cause acquired pes planus. Also, excessive tension in triceps surae, Achilles tendon could also lead to. So rigid pes planus is rare, but usually starts from childhood, congenital deformities, hindfoot pathology. So major symptom is strained muscles, pain. Yeah, all these are the symptoms. And pain, tight muscles around the foot, shortening of lengthening of the plantar muscles, and tight gastrocnemius, Achilles tendon. These are the findings. And edema around at the medial side of foot, stiffness of one or both arches of feet, difficulty in walking. So in medical management, what we can do is non-steroid anti-inflammatory drugs are sufficient for pain, and surgery is required in the rigid pes planus. In physical therapy, we can go for pain management, that is rest, activity modification, cryotherapy, massage, ultrasound, and flexibility exercises, stretching of gastrocnemius, soleus complex, peroneus muscles, and also strengthening exercises of flexor hallucis longus, intrinsic plantaris muscle, abductor hallucis longus. Also in relate to it, we can do toe heel walking for proprioception, better proprioception, single leg weight bearing, toe clawing of towel and pebbles. So recommended orthoses we can use for pes planus are support the inflexible foot. We need to support the medially with the orthotics, and as a Thomas heel is used as orthotics. So this is all about your pes planus, the flat foot.